Hi everybody, welcome to Healthline. I am Gregory Zarian. So it's summertime. As we invite you to do all the time from us to you, we hope you put down your phone, put down your computer, turn off the TV, anything social media, go outside and live your life. The sun is out, it's warmer, so you're probably spending more time at the beach, more time in the mountains, more time outside with your friends, and just taking deeper breaths in and deeper breaths out and just enjoying the outside. Life also gets a little bit faster. You want to go to places, see your friends, do things, and you're either in a big hurry or you're maybe going a little bit slower and relaxing. So what that means is sometimes you end up getting hurt more. You go to the emergency room, you go to urgent care. Which place do you go to? What do you need in your first aid kit at home? And what important things do you need to know about summer health and summer safety? So I decided to bring in one of my favorite people from Adventist Health Glendale, Dr. Anthony Cardillo, managing partner in the emergency room. I'll start off with this. I love you.
Thank you, Gregory.
And you are one of my most favorite doctors because you talk to us, you share with us, and you're really direct and you're really loving and caring to all of us here at Healthline and to the patients that I hear that you treat. So from me to you, thank you for all of that.
Thank you for having me. It's a pleasure to be here.
Summer's here. What do we need to know, doctor?
Yeah, just like you mentioned, we do see a drop in the flu-like illness as we enter into the summer months, so our volumes do drop in that regard. However, we do start seeing more injuries. Bicycle accidents, pedestrians being hit by cars, right?
Put down your phone, people.
Put down your phone. Children obviously having a lot of accidents. Monkey bar accidents are high on the rise. We also see a lot of bee stings, things of that nature, and also allergic reactions to those bee stings. So those are kind of the uptick that we see. A lot of broken bones, a lot of bicycle accidents, children not wearing their helmets like they should. Those are the accidents that we tend to see now in the ER over the summer months. You know,
Dr. Cardillo, I said something about urgent care and then emergency room. What is the difference between both of them? Because somebody will go to the urgent care and then be sent to an emergency room. What do we need to know in regards to what separates both?
Right, it's a great question because we have evolved into much more advanced urgent care centers now, and Adventist Health has several great ones. And for a long time we didn't have those, so a lot of people just wound up in the ER for all of their problems. However, now for more of the less complex, less emergent issues, as opposed to spending time in the ER, in the waiting room, and also distracting from the critical emergencies, it is better to go to the ER for things like mild coughs, low-grade temperatures, some broken bones as well, sprains, rashes, bladder infections, things of that nature, right? Things that don't require more intensive workups or admission to the hospital.
Okay.
So if you're, obviously if you're very sick, you're elderly, you're very young, you need a comprehensive workup, you go to the ER. 911 will always bring you to the ER as well. But if you're at home and you have a sudden onset of a rash, a cough, a sore throat, an earache.
I don't want to diminish if it's something a little more surface.
Yeah, something urgent, not emergent.
I love that, Dr. Cardillo. So it's not urgent, it's emergent. More with Dr. Cardillo and the emergency room and what you need to know this summer in regards to taking care of yourself. As I invite you to do all the time, take a deep breath in and a deep breath out and go get a glass of water. We will see you on the other side. Don't go away. Welcome back to Healthline. I'm Gregory Zarian. Hope you actually had 2 glasses of water and maybe grabbed a carrot stick. The conversation today is all about the emergency room and summer safety and what you need to know, the difference between emergency room and urgent care. But before we continue, did you know that Adventist Health Glendale is the top-ranking best hospital by U.S. News and World Report in Los Angeles and all of California? They were recognized for 5 categories of care. And also, did you know that Adventist Health Glendale is proud to continue to be voted the best hospital as voted by the City of Glendale residents and the Glendale News Press Survey? That's 4 consecutive years in a row. Thank you, Glendale. And as our mission to you here at Healthline is to give you all you need to know about you and living a healthy lifestyle. As I said, the conversation is all about the emergency room. Joining us from Adventist Health Glendale is Dr. Anthony Cardillo, and you heard me mention, I'll say it again, one of my favorite doctors. Dr. Dr. Cardillo, just to reiterate, the difference between emergency room and urgent care is one is emergent, one is urgent.
Correct. And so we tend to think of an urgency as something that is not life-threatening and that could perhaps wait till tomorrow, but you'd rather get it seen today,
Okay.
right? And in the ER, we're dealing with primarily heart attacks, strokes, significantly ill persons, very, very bad fractures, things of that nature, and things you have to call 911 for. Unfortunately, the ER has always been available 24/7, so people tend to come and use the ER for a lot of problems. And that's okay, and we welcome those patients to come in. However, if it's possible, we like to unload some of that volume off to our urgent cares. And if people find themselves in a situation where they have something that is urgent, right? You have a sore throat, you have a baby with an earache, infected eye perhaps, a rash, really bad cough. Right?
What about a cut?
A laceration, definitely.
Okay.
So in the urgent care centers, what we're able to do is suturing. We can do plain x-rays.
So suturing meaning stitches?
Stitches,
Okay.
exactly. So we can close up most wounds. Once they get to be very large, however, it's wise to go to the ER.
Sure.
But if you cut yourself while you're cooking, you have a small scrape that needs to be evacuated for some of the dirt, you come to the urgent care, we can do all of that.
And also what you're saying earlier too, kids may be on bikes. You know, they fall off their bike, they get a cut, they get a scrape, they do stuff like that. They then
Come to the urgent care,
Okay.
exactly. A cut, a scrape, or if you're concerned your child has a broken bone, perhaps, we can do a full suite of x-rays.
Okay.
We can't do CAT scans, the CT scan, or MRI, but we can do plain films. Or if you come to us, the benefit of the urgent care is that it's a great triage facility.
I love that
So if
you
you
said
come
that.
to us and something does require more advanced treatment, we can get you back to the ER very quickly, okay? And so that's something to remember, is that you're not isolated if you just go to the urgent care. It's a continuum, especially with Adventist Health Glendale, because we have several urgent cares in our neighborhood, in Verdugo Hills area, and also in the Glendale area. We have several urgent
Love
cares
that.
that if you go to, and we find that you have a more advanced problem, the doctors in the urgent care will call into the doctors in the emergency room, discuss the case, and we'll transfer the patient over.
And say so-and-so is on their way.
Exactly. So it's more of a continuum of care.
I love
okay?
that. And one thing too, though, with it being summer months and everything, some people may go out and get poison oak, poison ivy, may get dehydrated from swimming and all of that. And if they are feeling sick or nauseous, that's when they then go to urgent care.
Exactly. And we have the mechanism to give IV fluids, IV medications as well in the urgent care. We can do EKGs. If you're having some mild chest discomfort, it's always wise not to stay home, right? Severe chest pain, you call 911, you get to the ER. If you're a little concerned about maybe a discomfort, come to the urgent care. We can do an EKG, basic labs. If we find that you need further testing, we'll send you straight to the emergency department.
I love that. Emergency room. One of the biggest conversations that people talk about in regards to the emergency room is wait time. Let's just go there and then we'll dive into everything else. Why is there sometimes such a significant wait?
Yeah, we grapple with that all the time, and we have a whole team of doctors and nurses and administrators working on what we call throughput. So we're trying to maximize our throughput, the door to bedtime and door to discharge time, getting patients through the system as quickly and efficiently as possible without missing things. And that's kind of that, you know, the algorithm. We're trying to get people through the system quickly and not missing anything so we can have decreased waiting times. We have a 40-bed ER at our emergency department in Glendale.
I've seen it, it's
It's a
fantastic.
beautiful emergency department, but we only have 40 beds. And that's also dictated by our nursing staff sometimes. Nurses call in sick if they are sick, so we're down to 38 beds, let's say, or 36 beds.
Sure.
So what happens is that we have people waiting in the waiting room for less acute problems as we're dealing with the more acute problems.
When
in
you
the
say
back.
acute, share with us what that is.
So we may have patients that they're having a heart attack or a stroke, right, or are septic, which is a very bad evolving infection. So things that we're trying to resuscitate people for, asthma attacks, really bad wheezing, shortness of breath. These are things that we're trying to stabilize people, and all of our beds are filled. Unfortunately, when that happens, people have to wait in the waiting room. And then we have a dedicated area, which is called fast track. Now, fast track is very similar to what an urgent care is. And that's where you would go in the evening hours, because most urgent cares do close 8, 9, 10 o'clock
Sure.
at night. So if it's midnight or after and you find yourself having an urgency and you don't want to wait, then we have a fast track area in our emergency department. However, there is sometimes a wait to get in there. But we work very diligently to move people through our department as quickly as possible without missing something. But unfortunately, because our volumes are high during the summer months, particularly with injuries, there is a wait at times. However, we try to get that wait to be at least 30 minutes or less.
One thing I want to say about the emergency room, and this is actually a personal acknowledgement as to how fluid and efficient. As you remember, I came in last year with a family member, and from the minute I walked in, I was greeted. Tell me your name. To my family member, give me information. What do you have? What medicines do you take? Then went to somebody from the hospital to fill out paperwork, and within 30 minutes, family member seen.
Right.
So my comment to that is people need to be prepared when they come to the ER to bring in their insurance card, bring in their driver's license, bring in what medications they're taking. Just so the more information you have, the more fluid the experience is.
Exactly, very important.
When we come back, more with Dr. Cardillo, and get up, get another glass of water, stretch, and I will see you on the other side. Don't go away. Welcome back to Healthline. Our conversation today is all about the emergency room. Joining us from Adventist Health Glendale is Dr. Anthony Cardillo. Doctor, so when people are coming into the emergency room and they are dealing with what you said, some cases not as acute and other cases that are a little more life-threatening per se, what do you want them to know as they're waiting for so long?
Right, so as they're waiting, the reason they're really waiting is to see us as we're managing some of the more critical patients.
Okay.
And we also employ what's called the Rapid Provider Management System at Glendale Adventist, which means we can move patients through that have lower acuity problems. So we have a dedicated team of professionals, either nurse practitioners or PAs, that will see those patients while they're waiting in the waiting room. We pull them out, get them to triage, we get orders started very quickly, and then we put them back out in the waiting room while we're waiting to get the results back.
Love that.
So our RPM system is dedicated to help people wait less, at least get the process started. So when the doctor finally sees the patient, all of the labs, all of the x-rays, all of the EKGs,
so all the information they need to know.
It's all ready for us to then just focus on the clinical presentation. I would also ask patients that when they come to the ER, have a very good understanding of their story. Why are they there? Almost like you're telling a story to someone.
Sure.
Make sure you understand that the doctor is taking every piece of information that's being told to them and using that to help them make their final diagnosis. So have a good understanding of why your family member is here in the ER, what happened to them. If they fell down, how did they fall down? Why did they fall down? When was the last time they were seen before they fell down? Things of that nature.
Be succinct.
Yeah, be very specific, succinct, and know why you're there. Know why you're in the ER. Okay, it's very important.
Because a lot of people come in and they don't really know what they're talking about.
Exactly.
And it's not saying that they're not hurting it. For an example, if somebody was diabetic, have the complete story. You know, I'm type 1 diabetic, I'm this and that,
Exactly.
which gives you the more information which you can then pass on.
Exactly. Know your medical history, the medications that you're on,
Family
or
history is also
family
important, too.
history. And also, if you're there with a family member that you're bringing, make sure you understand their family history, their medical history, their social history, and the medications that they're on. And also, the history of the presenting illness. Why are they there in the ER?
And one thing too, talk to us about somebody sitting there and they're like, oh my gosh, my chest hurts or my stomach hurts. People self-diagnose. You know, Google I think is great, but then I also think that Google can get in the way of actually going to the doctors or going to the ER.
Yeah, it's a very important point that you make. And content in medicine is out there everywhere on the web. And it's a wonderful thing. And the more educated a patient can be, the better. However, by default, the internet tells a lot of bad information about medical problems, and people rush
Everyone
in,
thinks they're dying.
and they all think they're a first-year medical student, and they have every disease known to mankind. And that's important if it drives them in to ask further questions. But when patients are self-diagnosing themselves on the internet, that becomes a problem because a lot can be missed. Now, a lot of the companies are trying to invest in artificial intelligence, creating algorithms to help diagnose. That's a wonderful field right now, and it'll probably help us tremendously. However, right now, be very careful, very cautious on what you read on the internet. It's a lot of distracting information and a lot of information that can actually bring you down the wrong path.
So do some research, but also one thing that I said earlier about you is how easy it is to talk to you. If you have a family doctor, have conversations with your doctor. If there is something that is chronic and ongoing, call your doctor, set up an appointment and say, this is what this is. So the more information they give you, the more information you can then give to your ER doctor in case the other doctor is not ready and available.
It's the interpretation of the information that's most important, not necessarily the content itself. And so a lot of our diagnostic skill is in the subtleties of what patients are telling us, right? And so it's very important to make sure that you're having an open dialogue with any physician that you're working with, even if it's in the ER, which is a very, carved out, a physician-doctor-patient relationship. It's very, unique because it's very quick, it's very fast, it's someone you've never met before.
Sure.
And you're trying to get a dialogue very quickly with that patient.
Doctor, I want to laser through some of these. Somebody comes into the emergency room, a broken bone. What's the difference between a broken bone and like a hairline fracture?
Same thing. So we use the term fracture. A fracture is a broken bone. Okay. There's different degrees. So a hairline would be a very small fracture, which means the bone is not displaced, right? You don't have a displacement of the bone. Just as a hairline, you have a crack. And then you have very displaced and distracted fractures, right? Those are really bad broken bones. A little child will fall down, or an elderly person will fall down.
And you see those on hospital shows.
Exactly. And you can actually, any person, not even a physician, can say, oh, that bone looks broken. But the term is fracture, right? And so that's the medical term, and it could be a hairline fracture or a very bad displaced.
Which is still serious.
Exactly. And that displaced fracture may not heal properly if it's not dealt with properly.
So bottom line, and signs and symptoms of a broken bone are, just say it is a hairline fracture inside. No matter what, go to the doctors?
Typically, fractures will happen secondary to trauma. So fractures tend not to happen just from, non-traumatic episodes. You can have stress fractures, very mild, but typically you'll have some traumatic event, and then you'll have pain, obviously, and swelling. What I tend to tell a lot of parents is children, like all of us, have fallen down, and we'll have pain, and then it goes away pretty quickly. If the pain persists, a couple hours have gone by, the child's still complaining about their wrist, their ankle, their knee, their hip, likely there's a fracture.
Chest pain. What are some of the symptoms and causes of chest pain?
Yeah, so again, very important diagnostic workup. We prefer patients to come to the emergency room as opposed to the urgent care when they're having chest pain. However, you could go, if you're not having bad chest pain, chronic going on, but acute onset, pressure-like sensation, squeezing in the chest, So we call it substernal chest pain. Breathing difficulty, shortness of breath, pain that's radiating up to the neck, to the jaw, to the shoulder. These are all very serious signs and symptoms. Family history, right? If everyone in your family has had a heart attack in the past, be careful.
Possibly could have got it.
Exactly. Also, your social history. Have you used tobacco before in the past? Perhaps you're not taking care of your diet and exercise, so you've gotten a little bit obese. These are things that we look for: obesity, tobacco use, diabetes, hypertension, family history, all very bad things to be related to chest pain discomfort. Also age. Anyone under the age of 25 having chest pain is typically not having cardiac pain. However, they could have things like blood clots in their lungs or collapsed lungs. So don't think that because you're under a certain age, you're not having something serious. You can still have a problem, so come to the ER. So anything in the chest that is acute, hasn't been a chronic problem going on for months and months and months, get yourself to the ER, let us check you out.
Great. More Dr. Cardillo when we come back. And I have a question. What do you think you need in your emergency kit? What? I'll tell you on the other side. Don't go away. Welcome back to Healthline. I'm Gregory Zarian. Joining us from Adventist Health Glendale is Dr. Anthony Cardillo. Doctor, what is your education?
Well, I started as a paramedic in New York and got really interested in emergency medicine, and then went to medical school at USC. And then after that, applied to UCLA and was accepted into their program for emergency medicine, where I trained for 5 years. And then I made my way over to Glendale Adventist to work as an ER physician.
So with all of that and your expertise in the emergency room, there's also a lot at Glendale, at Adventist Health Glendale, that we were talking about during the break. We're a certified stroke center. We're a STEMI center. What is all that, and why do our viewers need to know this?
Very important. And I do think, honestly, that we have perhaps the best ER in all of LA County. We are a comprehensive stroke center, which means that all of the ambulances will bring stroke patients to our facility to have comprehensive care, not just peripheral care. So anything invasive that we can do, we have a whole suite of neurosurgeons and neurologists to help us intervene if someone's having a life-threatening stroke. Also, you mentioned STEMI Center. That's a heart attack center. So basically, we are the county's fastest STEMI center, or fastest heart attack center in all of LA County, which means that if you walk into our ER and you're having a heart attack, we can get you on the table and have the balloon open up that vessel faster than anybody else. And so I'm very proud to work in our ER because we have great resources, great leadership and administration, and I think we are the best ER in all of LA County.
And you know what I love that you have said to me for the years that we've known each other is you've celebrated the communication and the conversation that Adventist Health Glendale has with each department, with each division, that it's, even when you say the word triage, it's a conversation. You are a team, even if you're not in the same building, there's teamwork. Right. So very, very, very inspiring.
Yeah, we work very hard for that in all the departments in the hospital to make sure that it's all working together seamlessly.
Summer, what do we need to have in our summer emergency kit, safety kit?
Yeah, so it's important when you're out traveling. Now, my kit is probably a lot different than the kit that the average person carries. I have a whole suite of things that I carry. But for the average person, you want to make sure you have basic medications for pain control, Tylenol, Advil, Motrin, right, things of that nature. You want to always have aspirin available. If someone's having chest pain, you want to have aspirin available. You want to have a cold pack in your first aid kit. Kids have bumps and bruises, they fall down. The first thing, ice. Okay. Next thing is wraps. You want to have little ACE wraps. If someone has an injury, you can wrap it up with an ACE wrap, and also some of the 4x4 gauze tissue that you'd find in the local local drugstore. So 4x4 gauze, place on the injury, wrap up the ACE wrap, you're good to go till you get to the urgent care or the emergency room. Those are the basic things you like to have in most kits. And then if someone has an allergic reaction, right? So you want to have Benadryl at hand. So a little bottle of Benadryl.
Because earlier you were talking about a bee sting,
exactly.
Maybe even
poison ivy.
Poison ivy, an allergic reaction to all the pollen in the air, all
exactly,
of that. Okay.
Exactly. And if someone is in your family that has true anaphylaxis and bad allergic reactions, you want to make sure you take the EpiPen that your doctor has prescribed and have one in that emergency kit as well.
That.
So these are the basic things: pain medications, ice, gauze, wraps, anti-allergy medications. These are the things you want to have in your emergency kit that you take with you when you're traveling if you go somewhere. You don't want to find yourself and your child falls down and they have an injury and you can't wrap and stabilize it. Someone's having an allergic reaction, things of that nature.
And also a thermometer, possibly,
yes.
And maybe a Neosporin.
Yeah, the Neosporin is very good to cover basic wounds, and then thermometer if you have a small child, you want to check their temperature. Anything over 100.4 degrees, we consider to be an elevated temperature.
Okay, for anybody?
For anybody, 100.4.
What if something goes way below the standard temperature? What if somebody's below that? What if somebody's in the early 90s? Should that be a cause too for somebody to come in?
Yeah, so someone whose temperature is lower or hypo, right, not hyper, so they're hypothermic. We deal with a lot of people that have glucose issues. Their sugar drops, really bad infections.
Especially with it being summer too.
Yeah, they have really bad infections. They're also the temperature drop. Also thyroid, if they have a thyroid issue, their temperature will drop. So we are concerned about hypo temperature as well, okay, hypothermia. Hyperthermia, we get concerned with for infections and illnesses.
Signs and symptoms of dehydration.
So if a person has headache, tachycardia.
What's that?
So high pulse rate.
Okay.
Right. So if the pulse is going very quickly, they can be dehydrated. High temperature as well, they can be dehydrated. Weakness, muscle aches. These are all signs of dehydration.
And also, last thought in regards to sunscreen.
Yeah, can never overemphasize the importance of having proper sunscreen. Children particularly, elderly as well, don't neglect the elderly people. Top of the scalp, children, total body, adults, total body. Properly cover yourself with sunscreen.
Final thought in regards to the emergency room and what we need to know.
I think it's important to know that we're always there and available, and we'll never turn anybody away. So never worry that you're making the wrong decision on where to go. We're certainly there to welcome you and take care of you in the ER. Know that there could be a little wait sometimes. That's understandable, but we are working very diligently for every single patient to get them through the department as quickly as possible. So if you are waiting, it's not because people are just sitting back, having a cup of coffee. People are working very hard to move patients out of those 40 beds so we can fill it with new patients. So a little bit of patience yourself is really important. And know that we do have several urgent cares in town to tend to some of the more urgent but less emergent medical problems.
Dr. Cardillo, once again, thank you. Again, I love you. So you heard it from Dr. Cardillo about what you need to know in regards to the difference between the emergency room and urgent care. Summer's here. Wear your helmets. When you cross the street, put down your phone. Pay attention. A lot of the accidents happen from us not paying attention, looking down. It's life. Look up. Throw on your sunscreen. Drink your water. If you're going to go on a hike or go to the beach, let your parents and your friends know where you are. Your health and safety is just a conversation away. Our mission at Healthline is to give you all you need to know about being the best you can be. You can find us on social media. Please visit us at Facebook at @AH Glendale, on Twitter at Adventist Health. You can find us on LinkedIn, Adventist Health Glendale. For more information, please visit us on our website, AdventistHealthGlendale.org, and you can always find me at Gregory Zarian on social media. Have a great summer. We'll see you next time. And remember, the most important conversation you're going to have is about you and your health. So why not have one now? We'll see you next time.